Come up on this. I know you were here earlier, but that's good. We see people that are keen to get involved in this initiative, which is great. So just a quick introduction, Raphael de Souza. I'm a software as a service technology sales leader and also an investment specialist in Africa. I would like to give you the opportunity to just introduce yourself first and foremost, and then give us an idea of how your solution or how you're using solution to fight COVID in Africa.
Sure, absolutely. Thank you, and thanks for the opportunity to be here. So my name is Patrick Beattie. I am the CEO of Redbird, which is a US Ghanaian company in the health tech space. My founding team is myself, of course, Andrew Kwao, Ghanaian pharmacist, and Edward Grandstaff, an American computer scientist. And together we formed Redbird about 2 years ago here in Ghana. What we do at Redbird is enable convenient health diagnostics, medical diagnostics in community pharmacies. The idea here is giving patients an easy way to manage their health without making unnecessary trips to a hospital. And that's something that we've felt passionate about before COVID-19. We've been building this for 2 years. We're now in over 200 pharmacies in Ghana offering these diagnostic services for 10 different areas. But it's become even more important during the era of COVID-19, where it's not just about the lack of convenience and the cost of going to a hospital when you don't need to be, it's that it's also become quite dangerous for you and for the people at the hospital who are trying to focus on the most needy patients. So that's one of the areas. Of course, being a health tech company, we also looked at how we could more directly target the COVID-19 fight and assist in that. And so in addition to our traditional offering, we've launched a fully digital product, which is what we call RedSafe. It is a software product that enables a health facility or even a business to manage the COVID-19 risk of their staff and their customers. So think of it as an early warning detection system where you can see whether your staff or any of your customers, if you're doing this with customers, have increased risk for COVID-19 and maybe have them self-isolate or not come into work that day to just check on symptoms, maybe get a test if it's looking like that's appropriate, so that you don't risk your entire staff being exposed to this. And that's a product that we're currently running with Sweden Ghana Medical Center here in Ghana.
Fantastic, Patrick. Really appreciate that. Could you just give me a bit more of an insight into how you've perceived your sector, as well as your particular organization, having been affected by the virus?
For sure. So health tech's an interesting one, right? Because on one hand, we're not immune to the macroeconomic changes that are happening. When a country goes on lockdown, everything slows down, and that can be a bad thing for all businesses, health tech included. On the other hand, we're at a very unique point in time where the importance of health tech, especially decentralized health tech, is very obvious, and people are thinking much more than they usually do about their health. And so in a lot of ways, this has created an environment of acceleration of existing trends. Most health tech companies were already focusing on how do we expand convenience through decentralization. That's what we've been working on before. And COVID-19 has actually just put that into high gear because it's created even more pressure for that to happen. So in some ways, it's a very difficult time for this sector. In other ways, it's an incredibly exciting time because what we've been talking about for in our case, over 2 years now, is getting a lot more attention than it has in the past.
Interesting. So just mentioning or tracking back certain things you've mentioned, how do you see, or what place do you see digital technology playing in this fight against COVID-19? Is it a key factor? Is it just one of many? Just give me an idea of how, just the impact and how the gravitas of digital technology in fighting this crisis.
Yeah, absolutely. I mean, I think digital technology is one of our key weapons against COVID-19 globally. This is not just Africa, of course it's important here, but globally. And the reason for that is digital technology enables normalcy without direct interaction. When you boil it down, that's what a lot of digital technology does. This is what video chat enables us to do, right? Enables us to have a normal face-to-face conversation without being face-to-face. And limiting those interactions, those face-to-face interactions, is one of the most important things we can do in slowing down the progression of this disease, giving us time for scientists and others to find hopefully a cure, vaccine, or just our ability to better adapt to it. And so digital technology is key in that, and enables us to have all the benefits that human society typically achieves through interaction, whether that be scientific or just social, while at the same time reducing our risk.
Okay, no, that's amazing. But so you talk about risk that's not just limited to the individuals, but then, from a business perspective, etc. What would you say are some of the economic lessons to be drawn for an entrepreneur or for a business leader based on this crisis?
Yeah, so I mean that's a hard one because it's easy in retrospect to see lessons that you wonder whether you would ever actually be able to implement those, because no one expects something like this, or very few people expect something like this. But I think the thing that's really jumped out for us at Redbird as a key lesson that we've learned, is just the importance of relationships, both with your customers and your team and your own team internally. The importance of having more than just a transactional relationship with your customers comes into play when you have a situation like this where the whole world gets turned upside down. And you realize that if you're going to keep customers, if you're going to keep providing value to customers, you need to have known your customers better than just someone who's buying your product, but understand that, are you really giving something they value? Are you able to talk with them? One of the things we did early on in COVID-19 in Ghana was every week for a bit there, we had one of our staff members call every one of our pharmacy partners, not even for a reason necessarily, just to check in, just to let them know that, hey, you're important to us, we think of you. We're not pressuring you to do anything. We just want you to know we're here. And if you need something, you should be able to let us know. It's also helped on our team side. Before there was an official lockdown in Ghana, our team made the decision to move 100% remote. And we're still majority remote. We have a few people who will go into the office, but we're limiting how many people we will allow in the office right now. And we've been able to maintain high efficiency and productivity within the organization, I think in a large part just because of the team relationships we had built and ensured we built before all of this happened. It's enabled us to shift to remote without losing a step. And in retrospect, those are two things that have been really important to us being able to continue to operate at a high level.
Patrick, really appreciate you sharing those insights. We're coming close to time, but then as you know, this is going to be going out to quite a number of people, including investors and governments. So we just want to give you an opportunity as well as put you on the spot. So an opportunity for a 30-second pitch, your elevator pitch around your services. And in the end, if you could just give us a quick jingle around a preventative term in terms of advice that you're giving people, including INFORAFRICA as a hashtag, that would be great. So first, that 30-second elevator pitch, and then a nice statement from you about being INFORAFRICA and supporting it.
Yeah, thank you. We'll definitely do that. I'm Patrick with Redbird, where we enable convenient health monitoring at community pharmacies, giving patients the ability for a quick 5-minute checkup at a pharmacy and avoid an unnecessary and potentially dangerous hospital visit. At the same time, they build a digital health record, which enables them to then take all of this testing information to the hospital so a doctor can benefit from a fuller picture of their health when it is time for them to make that hospital trip. In addition to that, we're helping support or fight COVID-19 directly through our new RedSafe product, which enables any business as well as health facilities to manage their staff and customer risk to COVID-19 and ensure that staff safety stays one of their #1 priorities. To us, decentralization of healthcare is the leapfrog opportunity for Africa. It's the next one that's going to happen. And we're interested in connecting with anyone, investor, government, who shares that vision of the importance of decentralizing healthcare.
Excellent, thank you. And then just a quick statement on INFORAFRICA and just some advice you give to people.
Some advice, sorry, I'm going to ask.
Washing hands, you know, that type of thing.
Oh yeah, okay. Yeah, I mean, INFORAFRICA, I think the key thing that I think about and why I get excited about INFORAFRICA is we beat COVID-19 by staying connected, but also staying safe at the same time. It's important that we do the things that maintain distance so that we can slow the spread, but without losing each other. And so make sure that you are talking to people who are important to you, while respecting them and showing them you care by wearing a face mask, by staying inside or staying, away from others unless you need to.
Thank you so much, Patrick. You will stay in touch, and thank you for all your help and time.
I'm in for Africa.
I'm in it for Africa.
I'm in for Africa.
I am in for Africa.
I'm in for Africa.
I am in for Africa.
I am in for Africa.
I am in for Africa.
Thank you.